In this video, we'll be focusing on some extremely high-yield facts that will increase your score for the family medicine shelf and for the USMLE Step 2 CK. Now let's begin with cardiology and pulmonology. What vaccines are recommended in patients with asthma? The influenza vaccine and the pneumococcal vaccine. What diseases can cause secondary hyperlipidemia? Diabetes, hypothyroidism, and liver disease. And of course, if you can think of any other causes, leave them in the comment section below. When is home oxygen indicated in patients with COPD? Instead of reading off these values to you, I recommend that you pause the video here and look at the answers. Knowing the management for COPD is extremely high yield for the family medicine shelf and on the USMLE Step 2 CK as well. What will gram stain of a patient with conjunctival hemorrhage and whooping cough reveal? Gram-negative coccobacilli. So when a patient presents with conjunctival hemorrhages and whooping cough, you should suspect a Bordetella pertussis infection, which is a gram-negative bacteria. It is typically transmitted through respiratory droplets, causing Bordetella to infect the respiratory epithelium. So when thinking about the presentation of this, you have to think about it in 3 stages. You have the catarrhal stage. This is the phase where patients typically have upper respiratory tract infection symptoms. And then you have the paroxysmal phase, which is where they cough a lot. And then you have the convalescent phase. So typically when you do a physical exam, you find conjunctival hemorrhages, you see petechiae, they'll have post-tussive emesis, and lab findings can reveal lymphocytosis. So the gold standard diagnosis of these patients is a nasopharyngeal swab, and you typically treat them with azithromycin, especially those who are in close contact with a patient with this infection. How are these 2 parameters affected in carbon monoxide poisoning? So the partial pressure of oxygen will be normal, while the oxygen saturation will be decreased. What drug should not be used as monotherapy in patients with asthma? Long-acting beta agonists. How can the risk of oral candida infection be reduced in patients with asthma? They should rinse their mouth after each use of their inhaler, and they should also use a valved holding chamber. What is isolated systolic hypertension and how is it treated? So isolated systolic hypertension is when the systolic blood pressure is greater than 140, while the diastolic blood pressure is less than 90. It is typically treated with hydrochlorothiazide and calcium channel blockers. What is the mainstay treatment for allergic rhinitis? Intranasal steroids. What is the first-line treatment of community-acquired pneumonia? A macrolide. If you suspect asthma in a patient that is an athlete, but the PFTs are normal, what is the most likely diagnosis? Exercise-induced bronchoconstriction. How can cardiac and respiratory causes of shortness of breath be differentiated? By checking the BNP levels. Now let's move on to OB/GYN and PEDS. This is an extremely high yield section for you to know for the family medicine shelf. Okay, now let's begin. What are the most common causes of maternal mortality during pregnancy? Pulmonary embolism, preeclampsia, and hemorrhage. What is the most common cause of proteinuria in children? Orthostatic proteinuria. So, proteinuria is defined as having 2 plus or more proteinuria on a creatinine clearance. So, typically, what you do is a split urine protein test. When you do collection of the urine protein in the morning and again at night. So, when you do it in the morning, what you will see if they have orthostatic proteinuria is that it will be high because the patient has been supine all night. However, when you do it in the evening, it is low because the patient has been standing all day. How is the LH and FSH ratio affected in patients with PCOS? It is elevated. Remember that in PCOS, they have an unregulated GnRH pulse, which causes LH to be significantly more increased than FSH. This leads to very large numbers of androgens in comparison to aromatizations that occur. These patients typically present with oligomenorrhea and hirsutism. To diagnose them, it is typical to see the increased LH-FSH ratio. And to manage them, the mainstay is oral contraceptive pills. However, if pregnancy is desired, then you can use clomiphene or even metformin to help. What are contraindications for IUDs? Abnormal uterine anatomy, active PID, postpartum endometritis, and untreated cervicitis. Among BV, Trich, and Candida, which one has a pH less than 4.5? Candida. How you can remember this is by saying that Candida has a lot of A's and you have A in acidic, so the pH is less than 4.5. What is the tumor marker for ovarian cancer? CA125. What is the most common cause of neonatal mortality? Prematurity. What is the most common cause of infant mortality? Prematurity and congenital anomaly. Even though those last 2 questions sound alike, they're different. One asks about neonates and the other asks about infants. What is the most common cause of post-mastitis cellulitis? Lymphedema due to a non-GAS strep. What is the most common cause of hypertension in a patient less than 6 years old? Renal parenchymal disease. So if you have a patient, a young pediatric patient who is hypertensive, you need to get a urinalysis done, a urine culture, and renal ultrasound as well. What are features of jaundice in a newborn that indicates a serious pathology? And instead of reading off a bunch of different parameters, I suggest that you pause the video right here and read it through and try to remember it, because this is a topic that loves to be tested by examiners. What are features of a UTI in the pediatric population that will prompt further evaluation? Any UTI in a patient less than 5 years old, any boy with a UTI, any febrile UTI, any girl greater than 5 with multiple UTIs. What is the most common cause of galactorrhea in women of reproductive age? OCP use. What is the next best step in management for postpartum urinary retention? Foley catheter and close follow-up. What are the most sensitive and most specific criteria for diagnosis of bacterial vaginosis? Most specific, clue cells. Most sensitive, pH greater than 4.5. Recall that to diagnose bacterial vaginosis, you can use the Amsel criteria. And this is where the patient has homogeneous discharge, a positive whiff test, clue cells, which again is most specific, pH greater than 4.5, which is most sensitive. Okay, now let's move on to a high-yield review of neurology and psychiatry. What drug classes can cause serotonin syndrome? SSRIs, MAOIs, triptans, antiemetics, specifically ondansetron, and dextromorphin. You have to know serotonin syndrome inside out, especially the differences and similarities between it and neuroleptic malignant syndrome. It is something that is commonly tested on the shelf and on the USMLE Step 2 CK. If you know other drug classes or other drugs that cause serotonin syndrome, then leave them in the comment section below. There is a high-yield antibacterial drug that examiners love to test. If you know what it is, then leave it in the comment section below. What frequency is affected in presbycusis? High frequency. So they have sensorineural hearing loss. What is the most likely diagnosis in a patient with progressive loss of peripheral vision? Glaucoma. Are night terrors a non-REM or REM sleep disorder? Non-REM. It's very important that you remember the differences between non-REM and REM sleep disorders and which disorder falls into which group. It can be a pretty easy gimme question if you just commit that to memory. What is the most common cause of seizures in the elderly? Stroke. Which antidepressant is least likely to cause weight gain? Bupropion. What is the mechanism of action of this drug? Well, it is a alpha-4 beta-2 nicotinic cholinergic agonist. Its most common adverse drug effect is nausea, so it's typically recommended that you take it with food. What are the biggest risk factors for vulvar cancer? So this all depends on age. For older women, it's lichen sclerosis, and for younger women, it's infection with HPV 16 or 18. What is the treatment of choice of restless leg syndrome? Pramipexole and ropinirole. So patients who have restless leg syndrome, they present with an unpleasant sensation in their legs, an urge to move their legs, and it is typically worse at rest or at night. So it is suspected that this is due to low dopamine. So that's why the treatment is to increase dopamine with pramipexole or ropinirole. It is associated with anemia and chronic kidney disease. What is the best way to diagnose psychogenic seizures? Video EEG monitoring. What are indications for surgical intervention in clavicular fractures? Neurovascular involvement or a displaced fracture. So if they don't have these, then typically it's non-operative management with like the figure 8 cast. But if they do have them, then you have to go ahead and have surgical intervention. Okay, now let's move on to GI and endo reviews. So, what is the most common complication after a Roux-en-Y operation? Iron or B12 deficiency anemia. What treatment for Graves' disease makes the ophthalmology problems worse? Radioactive iodine. What is a tumor marker for pancreatic cancer? CA19-9. What is the most common cause of bacterial diarrhea? Campylobacter. What is the most common electrolyte abnormality in refeeding syndrome? Hypophosphatemia. How can you differentiate between primary and secondary hypothyroidism? TSH levels. So it will be low in secondary hypothyroidism, but high in primary hypothyroidism. What are indications for bariatric surgery? BMI greater than 40, BMI greater than 35 with comorbidities, and unsuccessful treatment with pharmacological agents. What is the most common cause of elevated LFTs? Non-alcoholic fatty liver disease. What is the next best test to do in a patient that presents with stones, moans, groans? PTH. What is the most common cause of hypoglycemia in a previously well-controlled diabetic? Diabetic renal disease. Okay, now we're going to cover the musculoskeletal system and some miscellaneous topics as well. Which opioid is on Bayer's list? Meperidine. So meperidine has active metabolites that increases the risk of seizures. What is the most likely diagnosis in a patient that presents with locking of the knee? A meniscal tear. What foods should be avoided in patients with a known latex allergy? Banana, avocado, chestnuts, and kiwis. When do advance directives go into effect? When the patient is unable to communicate. So this might seem like an obvious answer, but if you see a question stem and they're trying to confuse you, because they always try to confuse you by saying, hey, the patient has an advanced directive that says this, but the patient tells you something different. If the patient is there and they can communicate what they want to happen with their treatment, then what they say goes. So it's only when they're unable to communicate, that's when you follow what the advanced directive says. Who qualifies for Medicare? Individuals who are greater than 65 years old who qualify for Social Security, and those who have permanent disability with end-stage renal disease. What is the most common lower extremity stress fracture in adults? A tibial stress fracture. So this is very common in runners. And to continue to prepare for your family medicine shelf exam or for the USMLE Step 2 CK, all you have to do is click this video right here.